Thank you for joining Congressman Sean Casten's telephone town hall. We will begin shortly. If you have a question, please press *3. If you would like to subscribe to the Congressman's e-newsletter, please press 1.
Hi, Sean Casten here. I want to thank you all for joining. This is our second teletown hall on the rapidly evolving COVID-19 situation. In the last call, we were speaking primarily about the first two bills that we had passed out of the House, which were to provide food assistance, to provide support for small businesses, to provide extended support for businesses providing extended sick days. We have, of course, since that last town hall, passed the Substantial CARES Act. This is the $2.2 trillion bill to address some of the economic disruption. But I also thought it was really important in this call to really get some experts on, because we got questions in the last call, and particularly in this moment, we are in a geometrically accelerating situation, and it is critically important that we get accurate information out and that we do not send any more mistruths out there than just mistruths, because the situation's evolving faster than we can figure out where the truth is. And to that end, I'm really honored today to be joined by Pat Collier, Deputy Chief of Staff for Federal Affairs from Governor Pritzker's office, Laura Vaught, the Division Chief of the Illinois Department of Public Health, Mary Lou Mastro, President and CEO of Edward-Elmhurst Health, Dr. Sanjeeb Khatua, Chief Physician Executive at Edward-Elmhurst Health, and Karen Ayala, the Executive Director at the DuPage County Health Department. Each of them are going to speak a little bit at the start to give an overview of what they're seeing, both in terms of state legislative issues, public health issues, what we're seeing in our healthcare system. I will close with some overview of what we're doing at the federal legislative level, and then we'll open up to questions. The important thing about that is we want to make sure that we've got folks on the call who are really sector experts. I think the worst thing we can do is have me pretend to be a doctor or pretend to be in the governor's office right now. So I'm grateful to have them join us. Again, if you do have a question, you can press *3 at any time to get your question into the queue. And recognizing that we are going to continue to have these discussions and continue to learn more, we have regular newsletters. We are keeping current on the latest information as we have it. If you would like to receive those newsletters, press 1 at any time, and you will be automatically registered to get on our mailing list for that. So with that in mind, let me start by introducing Pat Collier from Governor Pritzker's office.
Thank you, and good evening. Thanks, Congressman Casten, for giving me the opportunity to speak here today with you and your constituents about this important issue. And for the sake of time, I'll just jump right into my comments. Today, Governor Pritzker announced an extension of his stay-at-home order through the end of April. The governor's choices are based on science and data and the guidance of health experts, which means normal won't start for us tomorrow, nor will it start next week. We must stay the course until the curve is flattened. To that end, yesterday the governor announced plans to temporarily convert part of McCormick Place, the McCormick Place Convention Center, into an alternate care facility for patients who are suffering from the coronavirus with mild symptoms and don't require intensive care. The additional capacity of McCormick Place will relieve pressure on the hospital system and free up beds for patients with more severe symptoms. McCormick Place received its first shipment of beds, 500, last weekend, and the Army Corps of Engineers, they've already begun the build-out. The aim is to have 500 beds up this week, 500 next week, 1,250 the week after, and 750 by the end of April. And again, the McCormick Place is a support unit, not a replacement for hospitals or traditional care. Two additional sites, the Advocate Sherman and Metro South Health Center, will be coming online and added support capacity as well. In addition, the Department of Public Health is asking for all licensed healthcare providers, many of you are likely on this call now, who are available to help in this response, such as physicians, nurse practitioners, physician assistants, medics, dentists, podiatrists, registered nurses, et cetera, to register at illinoishelps.net. Since March 19th, more than 1,200 medical and non-medical volunteers have registered to help in our fight against COVID-19. These workers are critical, and Illinois will continue to need more as this pandemic spreads. Any healthcare providers who are licensed and are interested, again, www.illinoishelps.net. Those are my comments this evening. Thanks again, Congressman Casten.
Thank you very much, Pat. Now I'd like to turn the mic over to Laura Vaught, who is the Division Chief from the Illinois Department of Public Health, to talk about what we're seeing from a public health perspective statewide. Laura? Laura, are you there? We may be having some technical issues with Laura. We'll see if our IT people can figure out how to get her on. Maybe perhaps she's muted right now. Let's move ahead. Mary Lou Mastro, the President and CEO at Edward-Elmhurst Health, to give an overview on what we're seeing in our healthcare system. Mary Lou, are you on?
Yes, I am. Can you hear me?
Yes, we can. Thank you.
Thank you. Thank you, Representative Casten. So certainly coronavirus has rocked our world, and I started out as a nurse working in ICU 44 years ago, and I can honestly say I've never seen an emergency response like this one. But I do want all of the callers to know that we're seeing the same dedication, the fidelity to our oaths, and the fulfillment of the promises we have always made to our patients. Healthcare workers across the system and the state are coming together to do whatever needs to be done. While so many others stay at home and shelter in place, our healthcare workers are willingly coming to work to take care of all of our patients, including those with coronavirus. So at Edward-Elmhurst Health, we've prepared for a significant surge in hospitalized patients, and we've established all of the policies, procedures, protocols, experts, and individuals necessary to take care of patients with coronavirus. We've planned how we will expand our bed capacity, increase the number of mechanical ventilators and other equipment that's necessary, and how to provide additional staff to take care of a rising number of patients, which we do anticipate. Dr. Khatua has engaged hundreds of physicians across our system to help us develop the care management protocols, determine how to do the COVID-19 testing protocols with the shortage that we have, to help our employees stay well, to establish all of the equipment and facilities that we need, and the infection control practices. We're working closely with our pharmacists to secure and judiciously use the needed medications. We've also established hotlines, triage nurse phone lines, and telephone or video visits to take care of individuals who either do not need to come to the hospital or who have questions about care. Certainly you've seen on the news that there's a shortage of personal protective equipment, gowns, masks, goggles, and gloves. We source every possible alternative for acquiring these critical needs, and we're fine for now. I want to say the outpouring of support from the community has been overwhelming. We've received personal protective equipment from dentists and construction companies and the school districts and citizens and businesses and many other friends and supporters. Early on, to reduce the spread of the disease, we closed some hospital and ambulatory departments. We stopped doing all non-essential surgeries and treatments. We do check the temperature and screen every individual who walks through the hospital doors, and we have implemented strict visitor policies. And this is tough to do because it's hard on our patients and our staff because we're used to embracing families in the setting. So I just want to say I've never been prouder to be a healthcare worker. I've never been so inspired by the creativity, passion, commitment, hard work, collaboration of all of the healthcare workers in our system and across the state. And I want to thank you, Representative Casten, and the governor for all of the legislators who've taken such decisive and quick action to help us secure supplies and to provide the regulatory and legislative relief we need to respond to this coronavirus in Illinois.
Thank you,
now
Mary
I'll turn it over. Thank you.
Yeah, thank you, Mary Lou, and thanks for all that you do. I think it's not lost on any of us how many of the folks on the front lines in this have responsibilities that vastly exceed their resources right now, and we appreciate that and would ask everyone on the call to recognize the heroes working in our healthcare system and show them some love if you can right now. Laura Vaught, do we have you back on the line now from the Illinois Department of Public Health?
Yeah, can you hear me?
Yeah, terrific. You are free. So, why don't you go ahead?
All right. Hi, good evening. My name's Laura Vaught, and I'm with the Illinois Department of Public Health. And I just want to thank Congressman Casten for asking me to speak with you all, and we really appreciate the support we've received from his office. As of today in Illinois, there are 5,994 confirmed cases of COVID-19. And as you may know, COVID-19 affects people in a variety of ways. Some people may not show any symptoms but still be carrying the virus, and some people may just be moderately ill but need medical care, and others may be impacted more and require a hospital bed or ICU bed, and doctors and nurses will still be needed, and they will still need personal protective equipment to care for everyone. We just want to make sure that we have enough resources for those who are the sickest and reduce the number of people who are exposed and infected with COVID-19, and it's important to flatten the curve, and that's where you all can help. As Pat said, tomorrow Governor Pritzker will be signing an executive order extending a stay-at-home through the end of the month of April. Essential activities will still be allowed, such as grocery stores, gas stations, pharmacies, but where you can, please think about what you can do to limit your going out to do those things, like ordering groceries for pickup or delivery. And if you do need to go out, please make sure you practice social distancing by maintaining 6 feet from others, washing your hands, using hand sanitizer, and avoid touching your face. If you do have family and friends that are still going out, visiting others, or engaging in social activities, please encourage them to stay at home. People in Illinois from less than a year old to 99 have contracted COVID-19. This is not a virus that predominantly impacts just the elderly. Staying at home and social distancing are the paramount strategies for minimizing the spread in our communities. You can find more information on COVID-19 on the DuPage website or coronavirus.illinois.gov. Thank you.
Thank you, Laura. I think we now have Dr. Sanjeeb Khatua from Edward-Elmhurst Health to give us a little bit more of an overview from the health situation. Dr. Khatua, are you available?
Yes, I'm here. Can you hear me?
Yes, we can. Thank you.
Okay. First and foremost, I want to say thank you to Representative Casten for his leadership. And I can't echo anything less than what Mary Lou Mastro had said about our healthcare workers and the heroes that they are. I have never been more proud to be a physician working with all of our healthcare workers who are working on the front lines. They are my heroes at this moment. So we are taking our leads from the CDC, which is the Center for Disease Control in the Illinois Department of Public Health. We obviously have some big challenges. We have supply shortages, a shortage of testing materials, and also the speed at which the science is changing regarding what the guidelines are changing very rapidly. So it's making the situation very difficult to manage, but at the same time, with the structures we have in place, we're able to adapt and pivot. We're watching the COVID-19 statistics and seeing what is happening in other areas of the world, such as China, Spain, Italy, and even more closer to home, like New York, Seattle, and California, actively reaching out to those individuals in those areas to see what they are seeing so we could be better prepared. We have learned a lot from them. It's also important for us to understand there is a shortage of COVID-19 testing capacity. This limits our ability to fully understand everything that we would like to know about the COVID-19 pandemic and its spread. Testing is really important because it allows infected people to know, if they are infected and to ensure that they take measures to reduce the probability of infecting others. Testing is also an essential for an appropriate response to a pandemic. It allows us to understand the spread of the disease and take an evidence-based approach to slow down the spread of the actual disease. Because of the limitations of testing, even the best existing research and data is preliminary and will be continually revised as this pandemic progresses. So we can provide, the number of confirmed cases at Edward and Elmhurst. So at Edward Hospital, as of this morning, we have 31 positive COVID patients. And at Elmhurst Hospital, we have 42 positive COVID patients. We know that the numbers are going to continue to rise. And as we think about our testing capabilities as well as our supplies, we're taking all this into consideration to make sure that we have what we need to best able to take care of our patient population. Thank you.
Thank you, Dr. Khatua. And we now have Karen Ayala, the Executive Director of the DuPage County Health Department, is the largest county in the 6th District, to give some sense of how what we're doing federally and at the state level is rippling down and being implemented in the at the county level. Karen, can you hear us okay?
Yes, I can. And thank you, Congressman Casten and your team. I'm pleased to join you. And I would like to say that as Health Department, we've actually been engaged in COVID-19 response since January 22nd of 2020, when the first case in the state of Illinois was announced. We are involved in case investigation and surveillance, which has extended from both community-based cases being identified as well as congregate facilities increasingly within our community. As of today, we have a total of 346 confirmed cases in DuPage County. Those 346 sadly include 10 deaths. However, we also understand that as a result of limited testing, which has been addressed by the previous speakers, that 346 cases represents a relatively small percentage of the disease prevalence within our community. As a health department, we stood up a call center to assist in addressing our residents' concerns. We have been conducting education with our partners in the community, with schools, first responders, and increasingly business owners who are providing essential services and need to keep their operations going during this challenging time. Finally, we have been working with the county in the Office of Homeland Security and Emergency Management to collect and then redeploy PPE equipment to our community partners. We too are operating under the guidelines established by the CDC and through IDPH. We greatly appreciate the coordination of those entities. If I could just wrap up my comments with the fact that we launched a on-site or a dashboard on our website yesterday, which does a great job of explaining the cases, the confirmed cases that we know. I would like to indicate that at this point, we have about 80% of the cases who are able to be maintained in outpatient settings, and testing has revealed about a 17 to 18% positivity. We too are looking at rapidly expanding number of cases being identified over this next several weeks to a month, and are making preparations to address the needs that come with that expanded caseload. Thank you.
Thank you, Karen. Thanks to all the speakers, and I believe people are going to stay on the line for some questions as they come in. I want to give a little bit of overview now before we open up about what we've done in Washington. We have passed 3 bills related to the COVID-19 situation. There will be more. This is not the end. The first bill was a $8.3 billion bill primarily focused on health issues, providing funding to public health agencies, providing funding for the development of vaccines and treatments. That also had within it a significant expansion in the Small Business Association lending capacity to start to deal with some of the economic issues, and extended telemedicine. That is now out, has been fully implemented. For those of you who have participated in some of our small business calls, there's some terrific resources in Illinois. If you've missed those, go to the website casten.house.gov, and you can see some of those presentations for where that sits. That was the first bill. The second bill we did, which was the Families First Act, was about a $100 billion bill. And if the first bill was designed to really address some of the fundamental scientific and medical issues, the second bill was really designed to address the economic issues specifically associated with people who have tested positive for coronavirus. So that included expansions in Medicaid funding to the states. It included reimbursement for businesses for people who need to self-quarantine for a couple of weeks, additional reimbursements for businesses where people need to go in and have become symptomatic and have to take some time off, expansions in unemployment insurance, increases in food aid in the various programs. We have to do that, particularly as schools have shut down, and make sure that we get food to schools that had free and reduced lunch programs. Those are out. Those are fully implemented. The $2.2 trillion bill that we passed, and I'm losing track of the days, less than a week ago. I guess it was last Saturday, early in the morning. is really designed to address some of the more structural issues going on in the economy. The weekly payroll of the United States is about $1 trillion a day. As we shut down the economy, the amount of economic activity that's slowing down, as everybody here knows all too well, is massive, and there is no one but the federal government with the capability to write that kind of check. But to be clear, our budget last year was about $5 trillion. So, even our capacity is limited, and we're the biggest dog on the block here. But this included significant expansions, $150 billion to state and local entities for their efforts. About almost $5 billion will probably flow to Illinois out of that. $260 billion in significantly expanded unemployment benefits. That includes benefits for gig workers, people on 1099s, people working for tip income. It's an expansion beyond what's normally in employment benefits. Direct monetary payments, $1,200 for each adult, $500 for each child. It's geared towards lower income folks, so as your income gets above $75,000 or $150,000 per household, the payment falls off, but the design is to make sure that people who have the most need have cash payments. About $375 billion in additional small business relief, $200 billion for hospitals, healthcare workers, healthcare research. There's more in there, but significant flows of cash to deal with some of the broader economic issues. There will be more. I think we have, as you might imagine, the speed with which we are legislating right now is heavily biased towards making sure we are making a difference exactly where it's needed, and we can deal with inefficiencies later. And so, future bills will find places where we made a little mistake, and we'll clean that up. We also are starting to think about what happens as we get into the recovery stage. What does that look like? That depends substantially on how long the economy has to shut down, what kind of damage it is, surgically where we go and look at where we have needs in society. But one thing that I really want to stress is that we cannot view this as a public health crisis trading off against an economic crisis. It is both. In order, as I think all the speakers have mentioned, in order to make sure that this disease does not spread and impact the entire population, we have had to take drastic measures to shut down significant parts of the economy, and I am grateful for what everybody on the phone is doing to make that easier, including all the listeners, because we are all sacrificing in this moment in ways that many of us didn't even know we were capable of sacrificing, and that is deeply appreciated. We also have to recognize that you can't separate economic pain from health pain. As people are shut down, we're already seeing some signs of mental health issues that are going to need to be addressed on a going forward basis. All the stresses that come from a family, as we all know too well right now, when maybe there's some income loss. Of course, if small businesses start to shut down, that gets even worse. Ben Bernanke made the point to us on a call I was on last week that statistically, we can say with a fairly high degree of confidence that this is going to be the deepest downturn in the United States economy since we have started keeping records. But if we do a good job on the public health side, it will also be the shortest downturn. And that's on us collectively to make sure that that happens. So we will continue to work through. My request for everybody on the phone, I have a couple of requests for you. Number one, as I said at the start, please be civil, be respectful to the heroes among us who are invisible. If you get advice from a public health worker who is stressed, who has fewer resources than they need, who wishes they had more PPE but is still showing up and risking their health for your safety, treat them with love and kindness. I know we're all stressed, but recognize where they are. Also recognize that the people who have been deemed as essential workers right now beyond the public health system are generally not the people who are making ridiculously large salaries. The people keeping our grocery stores open, keeping the food supplies coming, keeping the mail coming to your house. There's a huge amount of sacrifice going on in society beyond those of us who have the luxury to be able to telework right now. And just recognize where those sacrifices are. Be kind, be decent. That's how we'll get through this. The second request I've got for all of you is to recognize that we have a collective obligation in this moment not to amplify mistruths. I said at the start that this is a geometrically compounding issue. If we make a mistake in what we say to the public, to our friends this week, it has massive implications on what happens a week from now. And so we are all little news producers through our social media channels, what we share. Please be hypersensitive to not sharing misinformation. If you're suspicious about it, call an expert, defer to an expert. The reason we have the public health officials on this phone is because they are the experts, and we need to defer to them in this moment. And then I guess the last thing that I would add is that we have a significant issue that we are working on federally. We have got to deploy the Defense Production Act. The organization we need to have, I've talked to a lot of businesses in the district who would like to help out, who would like to be released from a patent infringement so that they can produce something, who would like to get supplies, who would like to know where to send things. These are all things that can be done once the President fully implements the Defense Production Act. We are doing everything we can to push the White House on that. I wish they were moving faster, but it is critical to do that so that we can really open up the controls that we have to have in this economy to save lives. Because what we do today, what you do on this phone today, whether you are a public health official, whether you're an elected official, whether you are, whatever you are as a listener, what you do today will determine how many people are still alive in June. And we have to take this seriously and go from there. With that in mind, we will open up for questions. Once again, if you have a question to ask, press *3. That will get you in the queue. If you would like to keep in touch with our regular newsletters, press 1. We will make sure to get you on the email list so that as we get accurate information, as information evolves, we want to make sure we get that out in a consistent, clear, concise, credible channel. And if you'd like to be in that, just press 1 and we will get you on that list. With that, I understand from Gail there were a few questions that came in at the start that we're going to start with. So Gail will open up, and then we'll turn over to the folks on the phone.
Yes, these were questions submitted by constituents in advance. The first question is for Deputy Chief Collier from Governor Pritzker's office. Sandra Alexander from Glen Ellen asked, states should be preparing now for the possibility that this virus could disrupt the 2020 election, forcing people to choose between their health and voting. What will you do to ensure that states are required to expand vote by mail to ensure that every American can vote without jeopardizing their health?
Thanks for that question. It's a really important one. Let me start by first saying Governor Pritzker has long been a supporter of vote by mail. And as this coronavirus situation continues to develop, the governor's office is making decisions and instituting policies to protect our citizens above all else. And decisions around these events, such as elections, as you just referenced, will be based on science, data, and the guidance of our health experts, with safety as our highest priority. But ultimately, this is a decision that will be made by the General Assembly. But the governor does support a vote by mail.
Great. Another question for you, Deputy Chief Collier. Denise Israel from Barrington Hills asked, realistically, how many months should people prepare to live in this current state, such as sheltering in place and making plans for the fall and winter?
Well, that's a tough answer to give, and I think, and I sound like a broken record here, but the governor's decisions it's based on science. It's based on the best advice of his medical experts, and that's how it will be moving forward. So the governor's office is prepared to keep these policies in place for as long as medically and necessary, and as long as scientific or science experts believe it's best for the state of Illinois in order to achieve the best possible outcome. I think first and foremost, we have to flatten the curve, and I think if we start from that perspective, it makes a lot of our decisions more understandable.
Thank you. One last question for you, Deputy Chief Collier. Kathleen Fantle from Wheaton, Illinois has asked, my husband's company is not essential. He works in a warehouse and he is 66 years old, but they are still expected to come in and work. Would there be any repercussions if he is not comfortable coming into work?
That's a very important question. If your husband believes that his company is not essential and therefore violating the stay-at-home executive order, I'd encourage him to contact the Illinois Department of Commerce and Economic Opportunity and report his concerns. He can do this a few different ways. First, by calling the CEO directly, 1-800-252-2923, or secondly, he can go online to www.illinois.gov/DCEO and click on the filing a complaint about non-essential businesses being open button on the homepage underneath the COVID-19 information section. And all of these comments will be anonymous, so you wouldn't have to fear retaliation in that regard. I also add that if the question is about whether a business is violating the order by not allowing for safe social distancing or not maintaining a safe and sanitary work environment, please contact the Workplace Rights Bureau of Illinois at the Attorney General's office. That number is 844-740-5076. And an email for the Workplace Rights Bureau is workplacerights@atg.state.il.us. And finally, if there's a question regarding employee benefits, including paid leave, please contact the Department of Labor at 312-783-2800. That's the Chicago office. The downstate office is 217-782-6206, or you can submit a concern via email at dol.questions@illinois.gov. Again, thank you for that question.
Thank you. This next question is for Ms. Vaught from the Illinois Department of Public Health. Michelle Pirano from Hoffman Estates has asked, where can I donate masks and gloves?
There's an email address set up that donations can contact. It's ppe.donations@illinois.gov. That's ppe.donations@illinois.gov.
Thank you. One last question for you, Ms. Vaught. Francis Velasquez from Glen Ellen asks, why are healthcare workers not being screened before working?
Healthcare workers going into long-term care facilities, hospitals, or correctional centers should be getting screened before they go into work. If that's not the case, you can contact the Illinois Department of Public Health at 217-782-4977, 217-782-4977, or your local health department.
Thank you. And now we're going to switch to the questions that are coming in from callers online. Our first question is from John Pittico in St. Charles. Mr. Pittico, are you there? Would you like to ask your question?
Yes, I'd like to thank Sean Casten and all the representatives on the phone for your awesome leadership through this. I'm a small business owner here in Illinois 6th District. I have a client who works in 3D printing, and they're actually have set up their home to 3D print PPE parts, like in their hallway and stuff. I look at the map, and there's 17 to 18 states who have not issued executive orders to stay in place. While the American spirit is great and can do, and everybody's stepping up, it is absolutely insane and infuriating that the Trump administration has not issued any federal guidelines to get ahead of this to save lives and to save businesses. Sean, is there anything that you and your colleagues can do? I'm talking storm the White House, whatever we have to do to get a nationwide response to this. It is absolutely infuriating. Am I the only one who's out of their mind frustrated with this? Thank you for the answer.
Well, so John, I think we are fortunate to be in a state where our governor has taken this seriously. I think I certainly share your frustration. As I said at the start, the executive branch has tools that the legislative branch does not have. We are pushing every day for the executive branch to implement those tools. I had to put this in some context, and I think we can be a little bit respectful of the fact that the countries that took this seriously at the start, China, South Korea, Japan, Singapore, they were all countries that had direct experience with SARS and they knew what this looked like. To put this in context, I had a gentleman from the Japanese embassy in my office in Washington a month ago who said that they had already had Japanese schools shut down for a month. And I said to him, just from a purely economic perspective, how the Japanese government decided to do that, because the Japanese economy is in a much weaker position than ours was at the time. It was growing at 1% a year. I said, this is going to be economically devastating. And he looked at me and he said, we have no choice. Now, the fact that those countries moved as quickly as they did was because they knew what the consequences were. It is inexcusable at this point that we are not moving as quickly as countries like Germany are. Even as places like Italy, who really bore the brunt of this early, they took nationwide action. We are doing everything in our power, and I think in some ways I feel like all of us on this phone call that I wish I had more power in this moment than we do, but rest assured we are doing everything in our power to make sure that the White House does everything in their power to prioritize this public health emergency.
The next question is from Beth Tomas in Wheaton, Illinois. Ms. Tomas, would you like to ask your question?
Yes, I would. And I, too, want to thank everybody for taking the time to inform us on what's going on. It's a pretty frightening situation. My question has to do with the stimulus. Households who have children will receive $500 per child. I have read conflicting information. The only thing that I've seen is clear is that the children must be 16 or under. And I'm wondering by what date, because it says during the tax year, and I've read either up to December 31st, 2019, or April 5th, which is the end of the tax year. It was confusing. So by what date? I have a child that just turned 17 on Sunday, and I'm wondering, will I be receiving a check for her or not?
So thanks for the question. The children under 17 are to get the money. The exact rules of this are to be implemented by the Treasury Department. And what we should know probably by next week what all those rules are going to be. Initially, what we were trying to do from the House was to have a direct payment go out with a direct deposit right away to everybody, and not do any screening, because exactly as you point out, the more that the government has to figure out who's eligible, the longer the delay before the money comes. And so what we had done in the House version of this bill was to try to get the payment to go out to all Americans and then have some obligations to return the money to the government over 2 years, and you could take it out through tax returns to go forward. What ultimately emerged from the Senate bill was a payment that was tied to prior year's tax income, and we are waiting for clarity from the Treasury Department and Mr. Mnuchin on exactly how they're going to implement that. What we are pushing for is direct deposit. What we're pushing for is anybody who's under 17 would get the $500. But circle back, and we should have clarity on all those answers probably within 5 to 7 days.
Our next question is from Tim in Barrington. Tim, are you on?
Yes, I am.
Go ahead,
my
please.
question is about the signing statements that accompanied that last bill for that $500 billion that's going to be spent. I hope that you are as concerned as I am that it gets to the right places. Could you tell me what the legislature is doing to try to enforce some kind of transparency?
So for the benefit of everyone on the call, you may recall that the first bill that emerged from the Senate had $500 billion of money that could flow largely at the president's direction, with 6 months of invisibility as to where that money flowed. We in the House said that was unacceptable, and in the final bill that emerged, there are specific rules that says, number one, the money can't flow to any any entities that are owned or controlled by the president or his family. Number two, any distribution has to be disclosed to a supervisory panel that includes a independent inspector general and then a panel, a bipartisan panel consisting of individuals appointed by the Speaker of the House Majority Leader, the House Minority Leader, the Senate Majority Leader, the Senate Minority Leader. That was all agreed to in the Congress, passed unanimously, and the Senate passed essentially unanimously by voice vote in the House. The President's signing statement that you referred to, he essentially said that he would not be bound by that supervision and oversight. Now let me start with a real easy question. That is illegal. He does not have the right. He cannot do that. The minute he actually approves that, he will be in violation of United States law, and we will do everything in our power to make sure it does not happen. As you can gather from the tone in my voice, I cannot believe we have to tell the President that, but that's the reality of this moment we're in. So he does not have that authority. We are absolutely all over that oversight, like you know what on you know what. But he doesn't have the authority, and if nothing else, he's told us where to monitor our oversight.
Thank you. The next question is for Ms. Mastro. It's from Becky in Lisle. Becky, are you on the line?
Yes, I am.
Go ahead.
Hi. Knowing that you, Elmhurst and Edwards have combined hospitals, I'm wondering with the one female that was diagnosed with the virus, did that help in any way as to how to help the state handle the cases that would come in, and if so, how?
Becky, let me try and answer your question this way. First of all, I think it's really, really important to understand that 80 to 85% of individuals who contract coronavirus will either have no symptoms or they'll have mild to moderate symptoms and will recover at home. And so with those individuals, what we try to do is encourage them not to come to the hospital. We want you to call your physician offices. We can do video visits, telephone visits to try and keep you from coming to the hospital. For the 15% of the patients that have significant symptoms, respiratory distress, those patients come through the emergency department or into the hospital, and we have very sophisticated ways of taking care of them. As Dr. Khatua mentioned earlier, we currently have 31 inpatients at Edward Hospital with coronavirus and another 20 that are suspected, and we're waiting for test results. So we have, once a patient is admitted, we do have in-house testing available that gives us a turnaround within 5 hours or so. We'll know whether or not they're positive, and then we have the treatment protocols in place to be able to take care of those individuals. I think, as the media has reported, it's for those individuals who are elderly and immunocompromised. They're the ones that get the sickest, and they're the ones that we are trying to protect with social distancing, which is why it is so important that we do exactly what the earlier callers have said in terms of hand washing and not touching our faces and social distancing. And yes, we have learned from our first case. We learned from other countries. We've learned from New York, and I think we'll continue to learn as we treat more patients.
Thank you. The next question is from Thomas in Naperville. Thomas, are you on the line?
Yes, I am. How are you this evening? Thank you for giving me this opportunity.
Go ahead and ask your question.
My question is for Mr. Sean is, how come the Democrats were so generous with all their side funds in the stimulus bill? Like the arts and the crafts in Washington, D.C., and not to the people. And there's many others which I do not have the time to talk about. And I'm an ex-medic. I set up these field hospitals all in my career in the Army. I know very much about them. I progressed it and suggested a Carmack Place probably quite a bit sooner than they ever decided to do it. So it's not all the federal department that has to supply these needs. I think our governor has to have a brain too.
Well, so let me just clarify, Thomas, and I don't know if you were here for the start of the call, but the U.S. payroll expense is about $1 trillion a week. The federal budget is last year, the federal budget was about $5 trillion. As we look at what is going to happen to the economy, we are likely going to be looking at 20% or more unemployment. You don't have to run that level of unemployment for very long before the amount of money flowing through the economy completely dwarfs the federal government. Now, what we did in this bill, and we did a whole lot of things in this bill, but a part of it was to make sure that we have the ability to provide cash flows to individuals who are affected. So the $1,200 per family that flows disproportionately to lower income families to get the people who are in the most need. If you have a household income of over $150,000, you're not going to see a lot of distribution. But if you're below that level, you are going to get distribution. This was meant to sop up where the need is. The second thing we did was we have the ability federally to reduce the expenses for significant numbers of people. So we did things like deferring student loan payments for federally backed student loans, blocking eviction from federally subsidized housing, lowering or deferring payments for people in state subsidized housing, boosting the Medicaid fund so that people don't have to pay out-of-pocket expenses, making testing free. All these things have the ability of reducing the outflows from people's pockets. Now, beyond that, we have to have support from the private sector. And the private sector can do things that we can't force them to do, like extending people's paid sick leave, like making sure that if they take bailout funds from the federal government, they don't use that money to lay people off, to renegotiate collective bargaining agreements, to pay money to their shareholders. We put all those strings on the money that we would provide to the private sector, but we can't compel them not to do that. But what we did do was make sure that for those public entities who we have oversight over, that those entities have resources to keep people on payroll and keep them from getting, into the social safety net. And furthermore, that we would make sure that those entities all have the resources that are necessary to work remotely and not make people sick. So, for example, there is $25 million in there for the House of Representatives. That has been totally misrepresented as a pay raise or something else. And this is why I said at the start, we got to be real careful not to amplify things that are lies. The money that was to the House of Representatives was to make sure that we can continue to do our job in a teleworking environment with sufficient IT to do that. It's the same thing that the private sector is doing now to make people safe, but we had to do it on our own as well. So the overwhelming majority of this money was to make sure that people who have needs get resources. And yes, the federal government is an employer, and as an employer, we are obligating ourselves to do the same things that we are asking the private sector to do. Thank you for the question.
The next question is from Dr. Vagabond from Westmont. Are you on?
Yes.
Go ahead.
Thank you for the opportunity. Thank you for the opportunity. I have two parts of the question. One is about the testing. The testing is taking, I've been working in many hospitals in the area. The testing is taking too long. I think we are wasting a lot of the PPEs while waiting for the reports to come back, especially the hospitalized patients. It's taking anywhere between 4 days to 1 week, and only few hospital systems have the capability to do within 24 to 48 hours. I think we need to have some ways to decrease this testing period very much as soon as possible. And second question is that we are discharging patients who are being positive back home. And if the patients are mentally disabled or they have substance abuse problems, and some of these patients cannot take care of themselves properly, these patients are a weak link and they're going to go back and spread the disease in their communities very much. So I think we need to have a better way of taking care of these patients so that they don't go back until they're negative. Thank you.
Well, I certainly agree with you, Doctor. And I will tell you that the discussions that we are having legislatively, which are heavily informed by what countries like South Korea have done, so we know that this is possible. We have moved much more slowly as a country, but it's to do widespread testing. That doesn't mean you test everybody, but what South Korea has done is tested statistically diverse samples of the population so that you can start to identify where do you see pockets of disease coming, where do you see pockets of disease slowing down. The second thing, and this gets to the second part of your question, is the next wave in testing is going to be for serological testing, which is to say testing for people who have the antibodies to coronavirus in their system. As Mary Lou Mastro mentioned, a lot of the people who get this recover or even asymptomatic. But as we start lifting some of the parts of our economy that are shut down, we want to make sure that we lift that in ways that we are not essentially reigniting a fire because we didn't realize there were a few sparks out there, to extend the metaphor a bit. So that's coming. You will see tests being ramped up shortly that have much quicker turnaround. I wish we had those tests available 2 weeks ago. We are getting there, but we are vastly behind the 8 ball on testing. And as you've heard Speaker Pelosi say, our top 3 priorities right now need to be testing, testing, and testing.
The next question is one of the questions submitted online from Ricky. The question is, what if we are freelancers whose income varies based on contract work? How would you calculate that? What would we ask for from the PPP stimulus? And do we have to pay it back as a loan, and with what interest?
The unemployment insurance expansion from the PPP program that you mentioned was specifically, we worked hard on this to make sure that those programs do include people working in the gig economy, people on the 1099s, people like yourself, Mike, so that you would be covered. That is being covered as unemployment insurance. This is not a loan. Those programs, as I said a bit earlier, will be rolled out probably in the next 5 to 7 days. I can't be more specific because we legislate, the executive branch then implements the law, and they're phasing those things up. But if you look at how long it took for them to stand up the programs that we created in the prior 2 coronavirus bills, it was about that time horizon. So I would expect next week you'll see some more clarity on that, and we will of course have continued conversations on this line. And as I mentioned early on, anybody who wants to get regular updates, not between these town halls, press 1 on your phone at any time. We'll get you on our email list, and we make sure that you're kept up to speed.
Our last question is from Mary in Lake Zurich. Mary, are you on the line?
Yes, I am.
Go ahead, please.
Okay. First of all, I just want to thank you for the way you conduct yourself and how professional and reaching out to everybody. So I thank you for everything you do, Congressman. My question is, I listen to this profusely all day, and I'm listening to the president that says that there's enough testing and we're not short of testing. And then I just heard today that we are. Which is it?
We do not have enough.
Wear masks, don't wear masks. Which is it? We need to hear the truth. We're asked of stuff and to follow protocol. And I think we need to do this globally, not just, state by state. The whole United States just shut down. So we can get a grip on this. But which is it? Have enough tests?
So thank you for the question. The answer is we do not have enough testing. We do not have any serological testing meaningfully at this point. We do not have enough PPE, and we do not have enough ventilators. I do not know why in good conscience a public official would lie about any of those things. We need those things out. The president has it in his capacity to significantly accelerate the deployment through the Defense Production Act. We are doing everything in our power to get him to do that. But we do not have enough there. We are putting our public health workers in positions that we should not ask them to be in. First, by asking them to go to work when they don't know whether they have enough PPE and getting sick. And second, asking them to, rather than focus on our health, focus on trying to figure out how to coordinate and get the supplies that they need. We need vastly more national coordination on this than we have. I don't know if any of our public health officials would care to comment or amplify or even disagree. You guys are the experts on this. Do you all think we have enough testing and enough PPE right now?
Hey, Sean, this is Dr. Khatua. I can try to answer some of the testing pieces. No, we do not have enough testing. I think we need that to ramp up, and I agree with everything that you said in terms of supplies, testing, PPE, the ability to get all of that, all those things to our providers to better be able to take care of our public, and I think you were spot on.
And this is Karen Ayala, and I would echo and amplify all of that. Not only our healthcare providers, but we see our first responders, police and fire and EMS, having to make really tough decisions on the use of their PPE in order to make sure that they have enough to get through the next week. So absolutely agree.
All right, the last question, I guess. We have time for one more. David Schaefer, calling from Glen Ellen. Are you on the line?
Yes, I am.
Go ahead and ask your question, Mr. Schaefer.
My wife and I are senior citizens, and so now the only time we go out is to go grocery shopping. And we're, it feels more and more like a gamble every time. And we're wondering how to minimize the risks of infection from other shoppers who unknowingly are positive for the virus, but non-symptomatic and contagious. My question is there any way of knowing, of being smart about the timing of our grocery shopping? Right now, the trajectory of the cases is, I've heard some estimates, it might peak in mid-April. So does that mean something like we just don't go grocery shopping for the middle part of April and hope for the trajectory to come back down again and pick up, presumably a better time to go out?
I think I'll defer to our public health officials on what's the best guidance right now that you'd give for that.
This is Karen again, and I would not suggest waiting for April 17th to grocery shop unless you have a very large pantry, because although that is when we expect and really hope that the curve begins to plateau, we're not sure how long it's going to stay steady until it begins to descend again. I think there are options for grocery stores some of them are opening an hour earlier, specifically for senior citizens. If in fact you have to go to the grocery store, I would try to time your trip so that it's during one of the less busy times of the day. Using hand hygiene and making sure you remain distant from other shoppers is also a very good idea.
Okay, thank you. I realize that there's a lot we don't know, so thank you for sharing.
Well, thank you all. I really want to thank Pat Collier from Governor Pritzker's office, Laura Vaught from the Department of Public Health, Mary Lou Mastro from Edward-Elmhurst Health, Dr. Sanjeeb Khatua from Edward-Elmhurst Health, and Karen Ayala from the DuPage County Health Department. Thank you for being on this call. Thank you for all of your service in this moment. And to all the folks who are listening in, thank you for what you are doing. We are all making sacrifices right now, and as I said before, what we do right now in this moment will determine how many of our friends and loved ones and neighbors, and even the neighbors we don't like that much, are still going to be healthy and well in a couple months. And so the good news about this virus is that the majority of the people it infects come out of it okay. They may be a little bit sick, they may be a lot sick, they may be asymptomatic, but they recover. That's also what makes the virus so hard to contain, because we don't realize that we have the capability to transmit it. So all of those bits of guidance you're getting from the experts about socially distancing, washing your hands, spending time with your family, we realize it's a sacrifice, but it is the sacrifice that we are all making to look out for each other. And we will get through this because we are all good and decent and loving people who look out for our fellow brother and sister. So thank you for doing that. And this too shall pass. Thank you all. Be safe. Be well.